Okay, now that you've all seen me get beat up, this was me before blood doping. Well, what is blood doping? Blood doping is a method of increasing the amount of red blood cells in the body. It also increases the amount of hemoglobin in the bloodstream so the blood can carry more oxygen to the muscles faster. There are certain ways to blood dope, like an EPO injection, homologous and autologous blood transfusions, injections of synthetic oxygen carriers, or just training in higher altitudes like Denver, Colorado. Our kidneys produce a hormone called erythropoietin, and it regulates your body's production of red blood cells. Patients can request to inject this hormone to stimulate their body's production of red blood cells. Blood transfusions are usually used for people that have lost or suffer from lack of red blood cells. Athletes usually do this to get more red blood cells so they can carry oxygen to their muscles faster. Homologous transfusion uses someone else's blood to replace or add to yours, and autologous uses your own blood, which is drawn and stored to be added in the future. You can also inject synthetic oxygen carriers like hemoglobin or perfluorocarbons. Training in higher altitudes is also a way to blood dope because the lack of oxygen from higher altitudes triggers your body's EPO to produce more red blood cells to aid in oxygen delivery throughout the body. By training in higher altitudes, athletes allow their bodies to produce more red blood cells naturally. This is the only legal way for professional athletes to blood dope or increase their red blood cell count. Now that we discussed some treatments for blood doping, here are some examples of what blood doping can do. This is more like it. Now we can talk about the risk of blood doping. By increasing your blood volume, your blood will thicken and make your heart work harder to pump blood throughout the body and lead to various risks, like blood clots, heart attacks, stroke, HIV, and hepatitis by blood transfusions or just high blood pressure.